Hello everyone, this is Dr. Kachepa from Inwood Dental. In this video here, I want to show a case of crown lengthening that we just recently did here in our clinic. This is actually a patient that I've known for a long time, and they had broken a tooth down, and here was the tooth. They called our clinic saying, hey, I broke a tooth and I think it needs to be taken out. So when all of the patients come to our clinic, typically the first thing that we want to do is be able to we will take an X-ray, we'll take a picture like this so we can see what's going on. As you can tell here, there's this whole crown on top of this tooth broke off. Now from the looks of this, you would think that this is a tooth that needs to be taken out. And then we also took an X-ray, and here's the X-ray. If you could see, here's the tooth all the way down to here, and in this case I could tell that there was enough root structure left here that if I did a root canal and we placed a post in here and we did a crown lengthening, I thought we could save the tooth. Now I gave the patient options to be able to do that. Here's a tooth here that was this wasn't done in our clinic, it was done by somebody else, and patient has a lot of compromised areas, but I was trying to save this particular tooth here. So you know, the option would have been that we could have taken this tooth out and did a bridge here, a 3-unit bridge from this tooth here to this tooth, or we could have taken this tooth out and then we could put an implant there in this side. Either case would work, and it depends also on the cost and how much. But in this case, what we ended up determining was that I think I could save this tooth actually with the root canal, doing a build up, and then crown lengthening. So what we ended up doing was we did the crown lengthening. We removed some of this tissue here, so I could see a nice stump around this tooth here. And then we did a root canal. Here's the gutta percha going into the root canal, and then later, as I mentioned, we did a crown lengthening procedure. So I removed some of this bone here and some of the tissue so that you could have enough of a stump here to be able to put a crown that's going to be stabilized for a long time. I also want to show this video. This other tooth here on this side also had a similar situation actually in this same particular patient. This was done about a couple years ago. We ended up saving it and it's been fine. The patient hasn't noticed it. We did a root canal, we did a build up, and you know, and then the same thing happened to this side. So again, here's the tooth here. Here's what it looked like when the patient was smiling from the front view. They had a little bit of stump here, but from the lingual you couldn't really see that much. So we removed some of this tissue here so that we would have enough to be able to put a crown on top of this tooth here. And so after we did that, we ended up taking an impression with the heavy body and light body material here. Here's the tooth here, the tooth number 6. And we did that. We sent it out to the lab, and before I talk about that, what we did was I wanted to take this impression actually with the digital scanner, but there was a little bit of hemorrhage, a little bit of bleeding around the gums, so I couldn't really control it. So what I ended up doing, I could control it a whole lot better with this impression material by doing certain little techniques that I've learned over the years. And we were able to get a very good margin, and the lab was able to fabricate the crown. So we had to fill out the lab script here. We had to tell them, you know, the dentist's name and then the patient's information, the tooth number 6, the type of material we were using, which was a PFM Portland fused metal. You could do a zirconia crown, or you could do a full cast crown, but the patient are not going to want this in the front of the mouth. You have to get the shade here, the tooth color that you want. I think in this case was a B1, and then the shade guide that you used. Typically we use the Vita, which is the classical shade guide that a lot of practitioners use. You sign it here, you put your dental license number here, and you send it out to the lab. Typically it takes about 2 weeks to get it back from the lab, so here it is. We got it back from the lab in a nice little box. We've worked with this lab for a long time. They've done a lot of great work for us, and the margins look good here. And then we got the model back, and here's what it looks like without the crown on. And as you can see, this is the tooth here that we did the crown length. Now the tissue and the bone, the tissue was all the way up to here. So after I removed some of that here and all around this tooth, then we had enough of a stump to be able to put a crown on. When we got it back, when you put the crown in, here's what it actually looks like. So this patient is actually coming in next week to be able to cement this crown here. It's going to turn out great. I have no doubt about that. The patient is currently in a temporary crown, so I fabricated a temporary crown that I put on here. So I'm going to remove that when the patient comes in, and then we'll put this crown on there. And it should last a long time. So we've done a lot of these crown lengthening procedures here in our clinic. I love doing them because sometimes patients come in and they're telling me I broke a tooth, and they're sure that that tooth is going to have to be taken out. Now, not all of them can be saved. There are many different factors that go into this, but some we can save them if there's enough tooth structure and enough root in the bottom there that I can justify making that decision that we're going to save that tooth. We saved this tooth here. I'm very confident about that. We're going to cement this crown again this coming up week. And I think the patient is going to be very, very happy with the outcome once we put it in. It's going to look very aesthetically nice. The shade is going to match, and it's great outcome. So if you have a tooth that's broken down like this here, and you're sure that it's going to have to be taken out, please give us a call. We think we might be able to save it. If we can't, we also have other options that we might be able to treat it for you. We can take it out, do an implant in here, or we can do a bridge in this particular case. But whichever one you go with, we want to make it affordable for you. We want to make it comfortable for you. And we see a lot of patients, and again, I've done a lot of these kind of procedures that have turned out great in the time that I've been here in my practice. So anyways, if you need a case, if you broken tooth, or even if you need a root canal or an implant, you need braces, you need a deep cleaning, you need your wisdom teeth taken out, we pretty much do all of it here at Inwood Dental. And we've had great outcomes for a lot of patients, and we hope we can do the same for you. Okay, thanks. Bye.